Fox 40's Karma Dickerson talked to healthcare workers about what people should know about the disease.
As monkeypox cases increase nationwide, both local and national health officials say the important thing is that local providers know what to look for when it comes to this rare disease.
Isolate, assess, report, and collect.
That's the headline of the monkeypox preparedness kits registered nurse Maureen Virgil gives to healthcare staff at One Community Health.
The provider might have the patient in the room, and then they say, oh, by the way, because that happens. And at that point, then they bring the isolation cards in.
One Community Health provides medical services from podiatry to pediatrics, but they began as an HIV care clinic.
What are some of the oh by the ways that could trigger this? Like, oh by the way, I've been out of the country, or oh by the way, I've got a weird rash?
I got this funny rash, and then they could, and I had sex a few days ago, and I noticed my partner had some rashes.
As specialists in infectious disease care and prevention, particularly sexually transmitted infections, they were on alert even before the first case of monkeypox was announced in Sacramento County May 25th. Now, there are 5 confirmed cases in the county and 2 more suspected cases under review by CDC.
It can easily be missed because early on it can manifest as another sexually transmitted disease.
Dr. Ben Balatbat, the chief medical officer of One Community Health, stresses the need for both patients and providers to be vigilant. You can get monkeypox by being face-to-face or skin-to-skin with an infected person for a sustained period of time, also through infected fabrics. Dr. Balatbat points out that monkeypox often begins with flu-like symptoms, which could be mistaken for anything from COVID to a cold, and the body rash that often follows could appear to be syphilis.
We need to be asking those questions and be examining those parts of the body.
One Community Health has run into 3 cases their clinicians suspected were monkeypox.
It was mostly just the lesions.
2 ultimately were negative, and the 3rd was sent just today to the Sacramento County Public Health Lab for testing. Statewide, the number of confirmed or presumed cases has grown to 21, and nationally, there are 100 cases.
And sometimes we don't necessarily know who may have it because people may not really seek care. So we have to assume that it's more than that.
While many cases had been identified as close contacts of infected people, the 2 newest suspected cases in Sacramento County are unrelated to the first 5, indicating that while national, state, and local health officials say the risk of infection and severe illness is low, the infection is still spreading in the community. They say the best advice for the public is awareness. If you have symptoms or think you have been exposed, testing and treatment are available locally.
You want to protect yourself and you want to protect the people around you. And you want to have that peace of mind. So just reach out, make that phone call, get the assessment.
People with symptoms or concerns that they may have been exposed are encouraged to be tested. One Community Health says you can come here to their STD clinic and be tested. You can call if you have questions. Reporting from Sacramento, I'm Karma Dickerson, Fox 40 News.